For me, a silent workforce is the sign of a disengaged workforce. So if you're not hearing from your people, it suggests one of three things. Either they don't feel safe to speak up, they don't have the mechanism to speak up, or they don't care enough about what is going on in the organization to speak up. And actually, the people that are working within your organization, those frontline staff, are the people that are going to know exactly what is going on in your organization. Um, I like to take a bit of an example here from my days of working in the NHS. Let's say you're working in an emergency department, you're some of the frontline staff in that emergency department, maybe a nurse in that department, and let's say a piece of machinery breaks. So let's say your X-ray machine breaks. As a nurse, you're going to see 100% of the problems that come with that. So you might likely be seeing the backlog of patients. You might likely be seeing patients in pain, sadly. You might be seeing patients' relatives getting a bit irate of having to wait a long time. You might start to notice that the emergency department gets really full, and you can see the differences with all of those people within the environment. You might start to notice the environment gets a little bit unclean because of all of the people that are there, and all the rubbish that maybe gets left. And so you'll be starting to notice a lot of these issues. You might see your team members coming onto shift and thinking, oh my God, this is chaos. This is really scary. You might start to notice doctors not meeting the needs of their patients in time as well. So you see 100% of those problems. Now, the executive team might only see that the waiting times weren't met. They might see that we missed our targets in terms of those waiting times. Now, if we're not hearing from the voices within the organization, we might spend time and money putting in place a fancy system to track why we're not meeting those waiting times. But actually, if we heard from those frontline staff, the people that are going through those situations, we might find some solutions, some innovative ideas that actually will cause patients to have a better experience. Maybe it's that it would have been great to have a volunteer come round and chat to people and give people a cup of tea. It would have been great to have an extra member of the cleaning team there. Maybe it would have been great if we had a porter to move people to different parts of the hospital where a different piece of machinery would be able to be used. So for me, the employee voice is really getting the diversity of thought, it's getting the innovation, the creativity from people, and it's helping move the organization towards its goals. So the NHS of patient satisfaction. So it's all around giving people the confidence to speak up, to share their ideas, to have the accessibility to speak up, giving them a way to speak up, and the opportunity to speak up by actually asking people.